cell a whole new set of proteins that would allow it to avoid antimicrobials. Yes?
What did you call the last type of resistance? The one where it turns off something so you can't find it?
This one here?
Yeah.
You inactivate the molecule, so you use another chemical to bind to it. So, how do you prevent the formation of these resistances? Most importantly, the medication has to be prescribed appropriately. That means that if you have a viral infection, an antibiotic isn't going to be effective. Why? We should already know. You should be able to tell me why. Maybe that's a great test question. Why isn't an antibiotic going to be effective against, or an antimicrobial, I should say like this, effective against a virus? Because the viruses are within the cells, right? A virus infects you by infecting your cells. Antimicrobials are not going to get inside your cells to destroy the virus. It would have to kill the cell. Antibiotics have to kill the cell in order to kill the virus. And so we can't use antibiotic treatment. That's not to say that we can't develop antibodies, which is a completely different thing, okay? We don't want to confuse antimicrobials and antibiotics with antibodies. They're not the same thing. So, antibiotics are only going to be effective against bacteria, against cells that are extracellular. And so if you're insisting on an antibiotic because you have a viral infection, you're taking a drug that is not going to be effective. And we, being educated, would never do that. But it's not uncommon to have a layperson insist on getting medication that they don't need. And it's important then for the doctor, and sometimes the doctor will give in simply because it's easy. They say, okay, well, here's your prescription. So to slow down these resistances that are developed, the medication needs to be prescribed appropriately. Then it needs to be taken as prescribed. I've already mentioned this too many times, but if you don't take the medication till the end of the period, and a lot of times it's 10 days for antibiotics, what you have happening is you're killing all of these guys and you're leaving this one to reestablish the population. So you want to make sure that you take them to the end, because that then can lead to the final death of the one that's resistant. The other thing that we just talked about in class as a current event, antimicrobials in our animal feed. Did we talk about that? I think we did, yeah. Major problem in that it allows for these microbes to develop a resistance when you are throwing out antibiotics to feed animals that don't really need them. Don't need the antibiotics because they're not infected, they're not going to come down with any kind of illness. You're just doing it to make sure that they gain weight or whatever. The microbes that are being exposed to that can develop a resistance. And so then those antibiotics are no longer effective. We do have antiviral drugs. I don't want to suggest that we don't have drugs that will treat viruses. But again, in most cases, you're going to be targeting the virus prior to it infecting the cell. So what you're doing is you're preventing the spread of the virus into new cells. And then hopefully your immune system comes along and kills those cells that are already infected. Yes?
For the drugs that work against the cell wall, why is it that they have to go inside the cell in order to work?
They don't. They don't. So let's go back. I guess I erased it. Penicillin and vancomycin would not have to enter the cell. They could bind to the molecules on the surface of the cell to carry out their action. vasopressin would have to enter the cell because it interferes with the transfer of molecules across the membrane. So it's going to depend on the action of the chemical itself, whether or not it has to enter the cell. But you're absolutely right. Some of them, if they're targeting the cell wall or the cell membrane, wouldn't necessarily have to enter the cell.
Just has to come in contact.
Just has to come in contact. One more thing I want to talk about here. Standard precautions. Protecting patients and healthcare personnel. If you're going into the healthcare profession, you're probably going to encounter this more than once. You know, the challenge has always been to prevent the spread of disease. And 100 years ago, the answer was to segregate people into different hospitals. So you had a hospital for tuberculosis, and you had a hospital for smallpox. But although that might have been effective in preventing cross spread of disease, it didn't really prevent transmission to individuals that might be coming into those hospitals. It wasn't really the best situation. Then we moved to isolating people into wards. So you were still in the same hospital, but now you were on different floors. And so we were still isolating disease, but you were in the same hospital. In 1980, they developed what is called the universal precautions. The CDC developed what they know, what is known as the universal precautions. And this came about because of the AIDS virus. And it was precautions that were designed to prevent the spread of the AIDS virus. Precautions telling the workers how to deal with body fluids, how to deal with blood, how to prevent becoming exposed to those. Then just 5 years ago, they updated these guidelines so that now there are 2 tiers of precautions that you would take. There's a standard precaution, which is fundamental precautions, hygiene, washing your hands, wearing protective gear, masks, and gloves and things like that. And then there's precautions based on types of transmission. These are supplementary precautions, and they have to do with disease that's highly transmissible. And so you would have to take special precautions for those microbes as well. There's a little blurb in your textbook with regards to these standard precautions. I won't test you on them, but if you are going into the field, you really should take a moment to read those. Okay? Any questions, any comments? Okay, I'm done for tonight. See you next time.